So great to have everyone here today for our 5th webinar in the Foundational TA series. As you know, we're looking forward to the wonderful content that our facilitators will be providing in this session. And we've got a lot, as usual, to get covered. So we'll go ahead and get started. My name is Sandra Rana, and I am a TA specialist with the National ECE Workforce Center. And we start all of our sessions with this announcement to be sure that we recognize our partners with the Administration for Children and Families. It is through funding with the ACF that we are able to offer this series and all of our work through the Workforce Center. And so while we work in close partnership with them, what is presented today does not necessarily represent the views of ACF or an endorsement by ACF. Thank you. So we'll begin with our welcome and introductions. For those of you who've joined us in previous webinars, these are familiar faces at this point, as the entire Foundational TA series has been facilitated by Dr. Sherry Killen-Stewart and Dr. Aisha Ray from the BUILD Initiative. You'll see them again today and next month in our 6th and final webinar. So continue learning from their expertise. And then for today's webinar, we're happy to welcome Yessie Robles Brown, who's the Chief of Staff at the National Association for Family Child Care, who will be sharing about their work and support, especially around compensation for family child care educators. And today we're also happy to welcome Alicia Leatherman, who is with the Department of Children and Youth in the state of Ohio, and will be sharing Ohio's work, especially focused on how they're working to sustain their ECE workforce strategies post the ARPA funding. So we're excited to learn from their work today. And so we'll begin, as we have in the last few of these. We'd love to hear from you about how you've been able to engage with these webinars leading up today. So we'll open this poll. We'd love to know if you've had the chance to either attend or watch one of the previous videos, or if this is the first time that you're joining this series today. So we'll give you just a moment to share that information with us. And Daisy, when it looks like we have a good number of responses, we can share those results. I know it takes a minute for folks who are still getting settled in, but we're hoping that you've had a chance, and if not, we welcome you and know that you can always go back and watch those recordings. And so at least 50% of you have attended, and there's a smaller percentage who haven't. So great. I'm hoping that those of you who've been watching the recordings or attended previously are seeing how the content builds on each other. And those of you for whom this is your first session, I know you'll get a lot out of today's webinar, and you'll have the links on our website to go back and watch any of those previous recordings to help make the connection to the previous content as well. Thank you for sharing that. So as we move along, please don't hesitate to put your questions in the Q&A at the bottom, and we will do our best to answer those during the webinar today. But for any questions that we're not able to answer, we will make sure to follow up with those responses. So we love getting your questions and making sure that you have the opportunity to get those responses. Thank you so much. And with that, I will turn it over to Dr. Ray, I believe. Thank you.
Yeah, that's right. Thank you so much, Sandra. Welcome to all of you. Very delighted to be with you today. My colleagues and I are going to talk particularly about one of the policy areas that the National Center is focused on, that is increasing compensation and financial relief policies, building them up in a much more effective way so that our early childhood workforce is really supported and stabilized. So in this webinar, we will have these goals. Applying the processes, strategies, and tools we've discussed in webinars 1 and 4, We'll focus on what needs to be considered to influence compensation and financial relief policies that intentionally and effectively remove inequities related to race, ethnicity, and other factors associated with discrimination. Secondly, to focus on sustainability of the policy, practice, and system changes leaders need to make to advance workforce compensation, parity, and financial relief benefits across all early childhood care and education sectors. We'll also continue to talk about this topic on webinar 6 and to focus on the work of our program partners, the National Association for Family Child Care, and that Yessi is going to talk about and their work in support of the early childhood workforce, and Alicia's work in Ohio and what that particular state has done to really stabilize the workforce and address compensation issues. So we welcome their participation as well. We want to just reflect for a moment on, we always ask you to think about what kinds of actions you're going to take in terms of advancing the early childhood work in your state around particularly those policy areas, but also other actions you plan to take. We captured some of these. I'm not going to read all of them. I am going to focus just on the headings, one of which is many of you wrote about not being a superhero, but really getting the work done and building it together with others in community and partnership. Very important message, and we are delighted people are thinking really hard about how to do that. To share knowledge and strategies with others on your team and others in your networks, to keep learning, to keep going back to ideas that you've had in the past or work that you've done in the past or work others have been doing, and to also think about new ideas that are being presented to you. To include others in the work all of the time, to look at who's at the tables you're working with, who's not there, how to connect regions across your state, how to look for options and opportunities, and how to reach out to groups that you haven't thought about before, but really need to be included. Next slide. In addition, we also heard you in those reflections about the webinar so far, the importance of advocacy, things like going to Congress, going to your legislature, building those relationships and strengthening them. To consider your particular role, what you can do, how you can clarify what you can do within your work and authority to support the workforce. Learning more about North Carolina's work, which was a focus of that conversation and in webinar 4, and to identify specific next steps. 3 of you talked about specific things. As a result, you were going to begin to look at apprenticeship programs. You were going to begin to collaborate with fellows around QRIS, consortium partners, to provide a community of practice. And 2 immediate ideas that came out of this was to have 2 non-contact professional days written into licensing rules and issuing educator IDs through their professional development system. So these are all powerful areas of work that people are engaged in, and we appreciate the fact that the ideas we've been talking about in the webinar series is resonating with you. Next slide. So for today, we want to start with another poll. This is about your the current status of your work on workforce compensation and financial relief. Currently in your state, tribe, county, community, or program, who is sitting and working with you intentionally and consistently to address workforce? I'm sorry, where are you? I'm sorry. Where are you in terms of intentionally and consistently addressing these issues? Are you just beginning to intentionally do this? Have you been working on them intentionally and consistently for at least 12 months? Have you been consistently and intentionally working on them for over 12 months, or are you not engaged at all? So we're going to wait a moment for those responses. So in terms of that poll engaged in terms of your engagement around these issues, about 28% are just beginning. 23% have been doing this for at least 12 months. Another 39% have been doing this work for over 12 months, and 9% of you not at all. So it looks like a chunk of you, about almost 70%, I'm sorry, almost 62% have been engaged in this at least 12 months or more. So that's very heartening. I want to encourage you to continue to do that. I'm going to turn to the next slide, please. We want you to think about these areas as we talk today. When we talk about compensation, we generally are referring to wage parity across all sectors of the early care and education workforce. The reason for that is we know that the discrepancies in salary that people and earnings that people are making are one of the key problems across our field. We know that all of the work is worthy and important and needs to be compensated fairly and justly. We want you to also, as we think about compensation, think about benefits such as health insurance, pension plans, paid sick leave, mental health insurance, and many other issues that fall under compensation. When we think about financial relief, we're talking about policies such as stipends and bonuses, tax credits, debt forgiveness, and so forth. Next slide. And you may be thinking of other things as well, so we want you to bring those to the table as we proceed. Let's try poll number 3. For those of you who answered the last question 1, 2, or 3, that is, you were doing some work, been doing it at least 12 months or over 12 months, and doing it intentionally and consistently, what entities are not in the decision-making process around compensation and financial relief in terms of your work? And here we have a list. Please check. There are multiple choices you can make. Please proceed to check who is not there. Workforce members representing centers and other sectors of the work, federal, state, tribal, county, and other entities, higher ed, state systems that control accreditation and training, childcare licensing, advocates, professional organizations, legislators, unions, and entities representing workers. And we know this is not an exhaustive list, so you could feel free to put into the chat other ideas and partners that you have engaged in as well after you finish the poll.
Where over half of the participants have responded. Aisha, would you like me to go ahead and share the results?
Yes, please do. Thank you, Daisy. So with over half of you responding, 31% had workforce members representing sectors across the early childhood workforce. About 17% of you do not have federal, state, tribal, county, or other entities at the table. Higher ed is not at about 47% of your tables that you're at. State systems that control accreditation, about 23% of you do not have those folks there, and 34% childcare licensing. We ask you this poll because we think it's important to think broadly beyond even our categories to who is really sitting there, who should be present around the development and reform of compensation financial benefits policy. So I would encourage you to think more about who should be there with you. Next slide. So next slide, please. We're going to talk about system networks. I want to stress the complexity of what we're doing, which I know many of you are veterans of early childhood policy work and understand how complicated our systems are. In some ways, we could argue we don't really have systems. We have individual entities across states that are managing program policy, but there's not a coherency to that. And one of the things that this slide reflects is our need really for a coherent system that can handle all of the pieces: compensation, program quality, tailoring responses to the workforce, and so forth, that is up at the top of the tree, the leaves of the tree, but also has strong roots in training institutions, professional organizations with advocacy, people who are doing advocacy, workers and unions, and other representatives, legislators, and of course, federal partners. So we wanted this is really a way to capture and to think about where our strengths, in particular states and tribal communities and counties and so forth, and what are the pieces I need to add as I go forward. Next slide. I want to remind you that these webinars have really presented a set of policies and processes and strategies to help you advance this work. So, in identifying the compensation of financial relief problems and examining their causes, this is a key issue, of course, that you need to do in developing whatever work you're going to do, using data from multiple sources and that define populations that you want to serve or have not served yet. Building networks of people and entities, including networks with workforce representation, using robust monitoring and assessment to make sure that you're making a difference and making a difference in the direction you want to make it, as opposed to retrenching or creating problems with the policies that we're putting in place. And of course, our emphasis all of the time is to take action within your role, using your authority, your influence, your responsibilities for making decisions, and using them with others to advance these critical issues around compensation and financial relief. Next slide, please. We want to stress that many of these policies are situated. We've talked about these 4 levels of policy change: the individual, the interpersonal, the institutional, and the structural. These policies, many of them are situated very strongly within institutions, particularly, for instance, state government departments that are administering early childhood funds, with legislators, with the workforce itself, and its interaction with those institutions. So we really need to build strong policies with institutions, practices of work, looking at regulations, looking at the kinds of things that are impeding our workforce and our own effectiveness as people who are trying to advance their well-being, to dismantle those that perpetuate inequality and design policies and practice that really lift our workforce, stabilize it, and make it able to do continue to do the quality work it has been doing under very serious circumstances. We also know that these policies are at the structural level. They often require legislation and law. They require financing at a significant level. And those structural changes really often significantly resist change. And so we have to work collectively together in order to make real change within the structural policy areas that allow us to achieve what we want for the workforce. Next slide. We want to always think about what the field is talking about. And we've talked a lot about going to the field repeatedly, developing relationships, using feedback loops, coming back again, to always engage with what is the workforce thinking. Here you have some reflections that we've gathered from people in the workforce around these issues. People say who they can't raise their children on the money they're earning. They can't even retire, though they've worked for 25 years. Their parents they're working with can't afford to pay more, so they can't charge more in order to hire more staff or support their staff with professional development. Not be able person says, I'd not be able to afford to do this work if I didn't have a partner, a husband who is earning income. And in my program, I am the cook, the receptionist, the teacher, and the accountant. And so people are overworked, they're stressed, they're not earning enough money, and they're feeling it, how difficult it is, as we all know. Next slide. Now, I'm going to turn to my colleague, Sherry, who'll introduce Alicia.
Yeah, I'm excited to introduce to you Alicia Leatherman. She's the Chief Strategy Officer for the newly created Ohio Department of Children, Youth, and the Chief of the Bureau of Maternal and Infant Vitality at the Ohio Department of Health. In this role, she oversees the implementation of strategy of federally and state-funded home visiting, community-based, and clinical efforts to improve maternal and child outcomes. And it's really important, as Aisha was just describing, that you're able to take action. And we thought we'd bring you someone who's doing just that to give you a taste. Thanks, Alicia. Thanks for being here.
Thanks, Sherry. And Sherry mentioned a couple of things. I just want to provide some context. We are in the process of transitioning to this new Department of Children and Youth. It was developed, created in statute in July, and we have moved 600 staff from 5 different state agencies into one agency as of January 1st. So we're very, very new, and so the information that I'm going to share is the work of a lot of people who aren't on this call with me, who did a lot of the implementation or who are working on implementation. So I'm just going to try to give you a high level of that. Next slide. So just about our department, these are our core principles around transparency, accountability, focus, prioritization, and maintaining local structures, which are really important here in Ohio. And our goals focus on empowering children, providing care, really about the community, and then supporting families in the best way that we can. Next slide. Just so you can see the breadth of the agencies that are moving to our new department, it really is from the time that a woman becomes pregnant in the maternal and infant vitality space to a child who is aging out of the foster care system and everything in between. So there are some programs that are not child focused, staying in other agencies, like WIC is staying in the Ohio Department of Health, but this gives you a general sense of the breadth of the programs that are moving. We've also tried to define an early care and education for our different provider types that are transitioning with us. And we've also tried to distinguish between funding streams and the funding streams that help to support activities rather than everything is for childcare, everything is for schools, everyone is regulated, everyone can participate in our quality rating system. And then you may have distinct funding sources that require you or allow you to do additional things. So our early care and education, our early childhood education program, that funding stream is our state preschool funding. So I just wanted to level set the language that we're trying to use here in our state when we talk about this workforce. Next slide. So again, just to level set, we're at about 10,000 licensed programs, 128,000 professionals. Average wage is $14.84, and I'll show you a little bit of information on that. Annual turnover, about 34%. And then our publicly funded childcare eligibility, unfortunately, from a FPL standpoint, we are the lagging behind. In our state, we're at 145% of FPL that we're currently starting with, but we go up to 300% insurance. Next slide. So this just offers some, as we're talking particularly around businesses. So we've had in our state some pretty significant gains in terms of industries moving into our state. So Intel is moving into our state and literally changing the conversation with employers just kind of overnight. We're planning the Columbus area, this metro area is planning to double in size, and it's opened up. The Ohio Chamber is talking about childcare, the Lieutenant Governor, the governor, of course, but just really this renewed interest and understanding of the importance of childcare. So this is a slide that we try to use to make sure that they understand what it takes in order for families to be able to afford or what the current cost is. Next slide. So this is just workforce data. So we work with our Child Care Resource and Referral Association, OCRA, in our state. And it really, that's where all of our early childhood programs have information going into them about the qualifications, credentials, turnover rates, the length of employment, average wages, all of the things that you see on this chart is captured in our Ohio Professional Registry. So we're able to look at, so the first 2 or 3 items are really about what we're trying to improve. So children demonstrating kindergarten, so that's our kindergarten readiness assessment. That is the top level, so you can see where we are, and unfortunately where the line around demonstrating readiness, where that's gone, and then also being on track for literacy, you can see what those numbers look like as well. So we're really trying to think creatively about this workforce that is turning over and that earns $14.84 an hour. You know, how can we support them ongoing? What you will note is you'll see from 21 and 22 that jump in 23, and we do think it's based on some of the strategies that we've implemented in terms of increasing the wages. Next slide. So I'm going to walk through a couple of strategies that have been implemented. Our rate increases, stabilization grants, infant toddler infrastructure, thinking about that public and private partnership and how we need to engage businesses again in this conversation, and then some shared services work. So fortunately or unfortunately, we had a non-compliance with the federal government that really allowed us to talk about our rates for providers. So we had a letter that was provided to us in April of last year where our rates were below the 50th percentile, and we really had to identify a plan to come into compliance. And ODJFS is our Ohio Department of Job and Family Services. It's one of the agencies where we're having staff transition from childcare and our children's services system over to the new Department of Children and Youth. So we're kind of assuming all of the responsibilities that they would have had on this non-compliance. Next slide. So what we've been able to do in a pretty short period of time is, so July 1st of 23, you can see where we started this fiscal year at the 25th percentile of our 2022 market rate in funding with CCDF and with state GRF. We then, in putting our plan together, increased the rate to the 35th percentile using our ARPA funding. And then slated, we have rules that are currently in clearance to increase to the 50th percentile for July 7th. And we would use CCDF and state funding to do an ongoing increase to those provider rates. What's interesting is embedded in this, we also focused on the percentage that we're paying for our quality rating system, which is higher for those programs. And our providers, that 35th percentile, those quick enhancements to the rates are really causing a lot of confusion for our provider community. So some things to take into consideration if you're considering what these rates look like and what those increases look like over time. For many of you who work in this space, you know that doing two rate increases in a 12-month period is pretty quick to do and can cause some confusion about the rates that are available. Next slide. We also did stabilization grants through COVID with our ARPA funding. And so we recently did a 4th round of stabilization from November until January. Folks could apply. We awarded $197 million. There were 6,000 applications processed, which were 89% of the eligible applicants. The next slide just breaks down what those criteria, what the amounts look like. So there was a base payment plus based on the capacity that you currently had at the time that we pulled it, which was in October of 23, you were able to receive a payment that you could use on a variety of things. And we know based on those wage increases that a number of programs invested their money in their workforce and in their salaries. So the example here is a medium-sized center with 80 children. They were eligible to get $41,400 during this 4th round of stabilization. With ARPA funds going away. This is the last round of stabilization grants that we anticipate. The next thing that we're looking at doing is public-private childcare partnerships and dedicating with our preschool development grant $6 million to really encourage, as I mentioned, those local organizations, local businesses to think about the needs of their employees, and also are there ways for us to strengthen the childcare system, delivery system. So we're looking to fund a vendor in each of the counties that are listed. Just for point of reference, the first 5 communities also happen to be the communities that are part of our Ohio Equity Initiative that have the largest disparities in our infant and maternal health, our maternal mortality rates. Licking County is the county that is neighboring one of our large urban, Franklin County here in Columbus, and that's where the actual Intel facility is going to be going. And then Allen County is a community that we also looked at through some of our infant mortality and disparity work, and is an area of our state that has a lot of legislative leadership, so we wanted to make sure that there were opportunities for those communities to also participate. And then you can see the identified need is how do we think about second shift, third shift, how do we determine what gap there is with the workforce, and how do we think about the support that families who don't qualify for publicly funded childcare may need helping to pay for childcare. Next slide. And so this just shows the roles, who will do what. So we're really looking at trying to find ways that if employees have ongoing, regular, high quality childcare, that hopefully employee retention and attendance can happen. And then with workforce participation and having more children in high quality care, if there are additional investments going into the system. And then we hope those local childcare providers have an additional source of funding, stable funding, and that building those local relationships just continues to strengthen the childcare infrastructure and that workforce retention. Next slide. We also did infant toddler infrastructure grants with ARP and preschool development grants. We had a tremendous amount of response, much more than we were anticipating. I think about 2 or 3 times more than we had money to support. So this was really to look at how to incentivize infant and toddler care being more available coming out of the pandemic. And again, I mentioned the Ohio Equity Initiative communities. You can see the 10 counties that are listed there. They're primarily our large urban counties here in the state of Ohio. And what we ask people to do is to serve or intend to serve infants and toddlers during the life of this grant, which is about a 9-month period. So they had to demonstrate that they would serve new infants and toddlers. So open up a classroom, open up an additional, restructure their program so that they could serve additional infants and toddlers at that time. You can see here the amount of funding that was made available to programs to be able to identify the need of whether it's hiring additional staff, getting program equipment, doing training. But this was an opportunity for licensed centers and for family childcare homes to access these resources. Because the demand was so high, we ended up using our ARPA funding for the centers, and then for the family childcare providers, we used the preschool development grants to support that work. So then finally, shared services. So we're initiating a process right now around shared services agreements and to identify organizations to help us think about the back end of working with early care and education programs to save them costs and to streamline their administrative burden. So the goal is really to have resources available to childcare providers that hopefully produce some sustainable business practices where those leaders can spend more time coaching and mentoring their staff rather than just simply dealing with the day-to-day and the turnover. So that's really the hope, is to provide some supports that help with that administrative burden. Next slide. So this is the type of information that's available. So a childcare management system, which I'll have a slide about, but participating in in-person and virtual coaching, There are also business management classes and then financial management classes as well to help support the provider. And then you can see these are regions in our state, and those organizations are part of our Child Care Resource and Referral Association, our agencies throughout the state, and you can see the support that they provide. So mentoring, business support, group purchasing, insurance. We have a number of our organizations that also do substitute pools, and then also kind of leveraging the expenses around equipment to see if there is an opportunity to leverage and buy in larger quantities to save money as well. So in addition to those 5 items that I highlighted, I just wanted to mention a couple of other things that we're doing through ARPA or through our professional development grant, our preschool development grant, or our quality dollars. So we do have Teach, Power Ohio, which is like a wages model. Recruitment of family child care providers. We do pay for professional development days, 2 per employee each year. We do have early childhood mental health consultation for all of our provider types, should they need it or their families be interested in receiving or having their child observed. We have that available. And then curriculum support, helping programs think about how to purchase and implement a curriculum to support that learning and to hopefully give their staff a little bit more confidence and comfort in thinking about what implementation looks like of that curriculum.
Thank you so much, Alicia. That was really enlightening. And I know for you all that are listening who don't get to talk to Alicia as often as I do, that it might be coming too fast, but you'll have access to the slides. But here's what I heard. I heard opportunities for financial support and compensation. I heard family childcare and centers. I heard data and measurement. I heard taking action using existing funds as well as the PDG. I heard working across structures. She talked about the Office of Job and Family Partnership and others. I heard monitoring, looking at the salary increases, looking at retention. I heard her talk about infants and toddlers and using the opportunities as a way to continue to build capacity. And most excited that I heard her say we're leaning in areas where people might not have had opportunity. And so we are leaning in there, removing barriers and increasing opportunity. So thank you so much. So now it's your turn with this poll. With your role, authority, influence, how are you responsible for advancing compensation and financial relief? I think Alicia gave us lots of examples, but how are you feeling in terms of being responsible for leaning in and taking action?
And Sherry, if it's okay, while we're waiting on the poll, just a couple of clarifiers. The 10,000 included center-based and family child care. Providers, just to provide clarification, we do not pay providers their salary directly. Like, we do not have a minimum hourly amount. So really it's up to the program, their employers, to pay their salaries, but we're trying to develop fiscal policies at the state level for programs that are choosing to participate in one of those 3 funding streams to think about how we increase the amount that's reimbursed, because we know the majority of that money goes to salaries.
Thank you. Okay, Daisy, let's see this poll. And Alicia, okay. So only about 7% feeling very responsible. That means you got to use your influence. About 26% though feeling responsible, 40% minimally responsible, and the 29%, I'm sure you have something to contribute to getting it done. So remember, it's about role, responsibility, authority, and influence. On the next slide, we want to talk about what you told us. You told us that what mattered most when we asked in webinar 4 was compensation and financial relief, followed by qualifications and educational support. So when you think about compensation and financial relief, answer this poll. What tools do you have? You heard lots of examples. Alicia didn't talk about one funding source, but she talked about grants and policy and scholarships and technical assistance even. So what tools do you have in order to advance compensation and financial relief? She talked about the business supports and the shared services and helping people have more time through shared services. Okay, Daisy, let me see. Okay, love this. So while we aren't as sure on the responsibility, we are getting a sense that there are multiple tools. And I think that's the point of us asking this question, is that it heard, and you heard in Alicia, multiple choices: grants, policy, legislation, scholarship, using different program model types. She talked about the TEACH program, technical assistance, and others. And I'd love if you picked other, if you throw it into the Q&A so we can see the kinds of things that you are thinking about. This is a great quote from a leader who's not with us, but in case you weren't clear where to start, she says, the key learning is that respondents really identified, and this is talking to the field, low compensation and the entrenched inequities in the field as very clear obstacles. And so that we really need to attend to that before trying to engage early educators in meeting other requirements and other national certification. So this flips upside down the way we often talk about quality childcare, have to get this, do this, jump this hoop. But in fact, if we're not attending the compensation, we have missed an opportunity. And so here's a poll, and Isha asked you something earlier, but which partners are essential for you in advancing workforce compensation and financial relief? Which partners do you need to have at the table? And again, if you've got somebody else, happy for you to throw it in the chat, but which partners? Because this is not work that we do alone, and it's not always about asking them to come to our table. We also want to go to their table and share our concerns and challenges and opportunities. Okay, let's see what we got, Daisy. All right, so we see that it's all of these partners, and really encourage you. Often people don't come to your meeting, but hang out at their meeting. Understand what they value, believe, and are worried about, and lean into that as an opportunity to share what you value and believe and are worried about. This isn't a short process, it's a long-term process, but it's great to see so many of you see that the workforce is essential, that federal, state, and tribe is essential. Higher ed has a role, state systems and accreditation has a role, licensing has a role. I saw earlier that less of them were involved in the earlier survey. Advocates, professional association, legislature, and unions all have a role in moving this work forward. So last one, I want you to talk back to us about, well, how long does it take to do these things? So you can use the QR code. Daisy, you'll put the link in the chat, I think, as well. But if you want to raise the base salaries for all workers, which Olga talked to us about, if you want to supplement salaries with stipends, if you want to get health and dental care benefits, which is a financial relief, if you want to ensure retirement plans or have supplemental wages through refundable tax credits, on a scale of 2 to 20, how long will it take to achieve these strategies? So let's look at that Mentimeter in a second. Okay, thank you all.
Oh,
Just checking out you're still filling it in. Daisy, can you hover for me? So in terms of raising base salaries, on average, we're at about a 2.8 as it moves around. Some folks feeling like, 2 years, and others are more in the middle around the 2.9. The next one, salary supplements. That looks like stipends, looks like something we can do sooner, in 2 years or less. Some feeling like it'll take longer. Health and dental benefits. Looks like some folks think that that's something we can do in the nearer term, which I'm sure the field would be happy. Ensuring retirement plans is more midterm. People are probably around 10 years or so. And then supplemental refundable tax credits looks like something we can do in the near term. So I want you to take this hope and carry it into your work, carry it into making a seat for yourself and others at the table for us to really lean in and be able to do this work. And Alicia, we got some questions in the chat, which I'm gonna share with you quickly because we got a couple of minutes before I turn it over. And one was asked, do individual programs determine what PD's taken during the paid PD days?
So it depends. If they're participating in our quality rating system, we have some guidance around the kind of professional development that we think may be helpful. And in our updated rules, we're actually, we have certain topics that we're asking them to get professional development in. But we do want the local programs to develop those professional development plans based on assessing their staff and meeting the needs of each individual staff person. But we also have an Ohio approved system through our professional development registry where for our quality rating system, trainings have to be Ohio approved in order for them to count for a quality rating system. So the concept is, yes, we want administrators to work with their individual staff, but if they are participating or if they would like to receive additional funding, there may be some additional guidance or suggestions around the type of professional development, the topics that may be useful for them to get.
Thank you so much. And I'm sorry we can't get to all the questions, but we always get the answers out. I want to thank you, Alicia. I want to thank all of you for participating with us with our polls. It gives us a sense of the audience and the things you're both advancing and struggling with. And now I want to turn it over for you to learn from the National Association for Family Child Care. Yessie Robles Brown is going to share their work with us. Thank you, Yessie.
Hi, happy to be here. Good afternoon, everybody. A little bit about me. I am Yessie Robles Brown. I'm the Chief of Staff with the National Association for Family Child Care, as well as uplifting and pushing forward our policy and advocacy agenda with the support of our home-based family child care educators. A little bit about what we do. NAFCC supports and leverage a nationwide network of home-based family child care educators, providers, and partners in expanding and promoting the power of family child care. So how do we do that? We connect practice, policy, and research. With our membership program, we are often adapting our benefits and perks that is reflected to the needs of home-based childcare and workforce development. We offer professional development training that offers credit needed for our national accreditation. And we have a national recognized accreditation program that has been co-created with a body of experts as well as including family child care educators. And through our policy and advocacy work, we make sure that the voices of our family child care educators and the educators themselves are at the table where decisions impacting their work is relevant, and we're always opening those opportunities to them. Next slide, please. So family child care educators in particular face substantial financial hardship, often, as we know, working long hours for modest wage that failed to support retirement planning, or cover basic living expenses. We heard that before, we hear that often from our base. And our educators emphasize the need for living wages, life-sustaining wages, retirement plan, and affordable healthcare options to sustain their profession effectively. We know this is a labor of love. So a lot of the time we hear our educators who want to stay in the fields, but these are pressing just requirements and necessities that they have that are just competing for their time and their love for their profession. Our members share, in order to have a system that is inclusive to the success of family child care educators, there needs to be a change in practice with regards to allowing family child care educators to earn the true cost of care, and make that living wage that will allow for them to pay for their retirement or plan for their retirement, or think through retirement programs that are available to educators looking to retire soon. So thinking about how can we envision or vision forward a way where we have educators who are nearing that time to make that accessible and available to them. Access to subsidy programs that pay educators per enrollment rather than attendance in the beginning of the month, rather than reimbursing after the fact. That's a huge pressing issue that we do here, that need for the payment for enrollment instead of attendance. And also, we know that we cannot control the cost of rent, mortgage, and that timeline. So there should be payment done in a timely manner that's more predictable. And what we're hearing is educators cannot cover their household expenses if they have to navigate a complex system that it will reimburse them way after the fact. So thinking 4 to 6 weeks after care has been provided. Next slide, please. But we know it doesn't have to be this way. We've heard and we had a glance and tons of learning from the COVID-19 pandemic. And that was a time where our country was able to remain operational because of home-based family child care opening their doors at a time where a lot of places had to close their doors. So we often recognize that our home-based family child care and family friend and neighbor care were able to continue to be the workforce behind the workforce. We learned through the ARPA state fiscal recovery fund that it provided the necessary income for educators to provide updates and necessary updates to their programs to safely care for our children at a vulnerable time. We allow educators to pay their staff through the funding and themselves the family sustaining wage, while keeping price low for families who are unable to pay for the tuition and true cost of care. So we already know that our family child care educators operate at a razor-thin financial margin. So the ARPA stabilization grant was able to give wiggle room to breathe and really push forward to stabilize their programs and push forward the necessary updates and fixes that needed to happen at a time that expedited that. We were able to finally vision what a stabilized childcare sector can look like, that is inclusive to a home-based program, and then competitive and quality option, and positioned home-based program as that quality option for families. And with the expiration of pandemic-related relief, we did see programs closing its doors because, again, going back to operating on razor-thin margins, or the having to limit and reduce hours is just a business practice that didn't for them to continue forward. So we did end up seeing some closures after the ARPA funds. And with that, we also realized that these payment practices are becoming unsustainable, right? Certain states issue provider reimbursement weeks after care. After the expiration of ARPA fund, we saw educators have to reduce the hours of care, increase their tuition rates, offer care to fewer children, or not to cover the wage of an extra staff member. So that's that ratio, thinking about, I can't really account for another staff member, so let me reduce the number of children and then I'm allowing my program so I can be the sole provider and the sole person on staff. We know that it started to become a little challenging with the cost of living rising, and groceries. That's another, when we did our survey, we heard quite a bit about the food program and the prices of groceries, also eating at what their take home has been. So when we reimagine childcare, an ECE mixed delivery model system that truly works, we must include the experience and learnings from our family childcare home-based educators and family friend and neighbor care. So really thinking about, and what was mentioned earlier, who is not at the table, who is not being reflective, right? When we're thinking about a true mixed delivery model, and when we're thinking about and pushing for a policy change, how can we continue to be inclusive to the people who are not often represented? Next slide, please. Oh, sorry, one slide before. I didn't realize that was ours. So, we must engage family child care leaders as equal partners and build in compensation and flexibility to respect their expertise in a time where we're reimagining and looking for solutions in our ECE systems. And that can take on many forms. We need to make sure we compensate for work completed and time provided input. This can also provide an additional income stream that will allow for their lived expertise to be valued. So really thinking about how lived expertise can be valued and compensated for via stipends or other financial opportunities to really ease that burden. Make sure we are engaged throughout the design and implementation process, not just where we think feedback or thoughts are needed. Again, when we're reimagining a care and early childhood education system and changes within, family child care educators can provide a lens and perspective that we may have blind spots towards. So it's also very critical for us to continue to be inclusive throughout the entirety of the process. We have home-based educators who are eager to elevate their leadership and be tapped as content experts in the childcare field. So we can provide opportunities by closing the knowledge and technical skills gap with educators to ensure that they can meaningfully contribute throughout the design process. And we can do that by ensuring that we're constantly asking us, are there perspectives that we're missing? So we need to invite multiple perspectives, such as home-based care, family, friend, and neighbor, license exempt, because we also have to recognize that not every state recognizes or has a licensing body. So, but that doesn't mean there isn't home-based care in those states. So really thinking more critically about who is not at the table and how do we engage them. And accessibility. What we often hear is educators will more likely participate if there's opportunities after hours or after dismissal time or during nap time. And there will be more participation and willingness to participate if there is linguist and language accessibility and language justice. So making sure that we are not talking in acronyms and legalese, but having language that is accessible and in a language that's accessible in that it's another language other than English. Next slide, please. And we are happy to see and share areas where changes and policy shifts have been inclusive of home-based and a mixed delivery model system. We are seeing state funding grants and opportunities supporting small business owners. We are seeing states stepping up to the charge of stabilizing childcare and providing funding to transform their ACE systems and be inclusive of a mixed delivery model. So the Century Foundation put out a report that really speaks to the states and their investment and their increased investment in their childcare systems. So just to mention some of the states: Alaska, California, DC, Illinois, and New Mexico, just to name a few, but there are many more that have decided to prioritize the childcare crisis within their state. With compensation parity, we need to start from a similar baseline and understand what the true cost of care is. So we're happy to see that there are states and research agencies that are really pushing for that, and where we can really see and understand what the disparity is. And that's an opportunity for us to call on Congress to provide an increase and sustained funding to childcare. And I think once we really have an understanding of what the true cost of care is, we can organize and be more focused in our advocacy when providing a number of what a sustained increase of cost of care can be on a federal level. When it comes to accessible pre-K, early Head Starts, and public controlled care programs, we need to make sure that the rollout of the 3Ks and pre-Ks are inclusive of home-based care and not an afterthought, which is what we've heard in our survey that tends to happen on a phase 2 of a pilot of a universal pre-K rollout of the state. So how can we be intentional and be inclusive in our family child care programs who are willing to participate, but also how can we provide TA and information that's accessible to them in the language that again is inclusive to them. So we have information on how these public contracted programs can operate and be inclusive, but then how are we getting the information out, and is that information available and accessible? And we've seen guaranteed minimum income for family child care educators as pilots. I believe in New York, that was the case, where educators can start to think about paying themselves, their staff, and they've used the funds to access healthcare, to plan for their retirement, get an additional staff member or what have you, but it just kind of helped move out of that I'm operating in a razor thin margin mindset and kind of really start vision forward and have the investment be on themselves. And how can associations and educators provide community and mentorship? So what we've learned from our family child care educators is when they have a peer mentor or when they have support, they're more likely to stay in the field. And there's often transformation that happens when a collective group of people come together for a common idea or common good, right? So what we've seen is, as an example, in California, we had family child care educators push for the longest time and successfully have a union that is reflective of home-based child care. And that union is pushing for a lot of change in California. That model may not work in other states, but what we have been seeing, for example, in New York, is that they're a group of family child care educators teaching themselves, providing information through a massive WhatsApp group, trying to organize and push for in their state legislators for change. And I think these are ways where we can learn from each other what's worked in each state when we have family child care educators put on their advocacy hat, and what can we learn and how can we then as a national platform support them in calling for those kinds of changes that are appropriate in their states. Next slide. And that's really it from my side. I wish I could speak more. I love this topic and subject, but we can definitely, I believe, envision a path where there is a livable wage and life-sustaining compensation in the world of family child care. Thank you.
Thank you, Yessie. We have a little extra time, I believe, unless my colleagues tell me otherwise. There are some questions for you and for Alicia. So I want to see if we have time for each of you to answer at least one question relatively briefly, even though these are complicated questions.
Yeah, Alicia had to pop back to work, so yes.
Okay. Thanks, Sherry. Linda asked the question, has there been any research to determine what the financials need to look like for a center or family childcare to be profitable? For example, cost analysis for the state on what if scenarios. Are you aware of anything you can share with our listeners about that?
We do have a partnership with Civitas that can help in providing that, and I can ask and provide that as a tool if there is a resource that we can share after the fact. But I believe so. I'm not quite sure if it's to the extent that you're looking for, but I can definitely ask our partners to see if there's something material-wise that we can provide as a resource and a guide.
Great. So yes, I think it is possible for us to put that on the website if you share it for the National Center around these professional development webinars. The other questions I see, I'm not sure. I think Jason's question is about, I'm going to say the question, you can see if it is in your wheelhouse. Yessie, is there a theory of change? Not specifically, because I assume around, I guess, public-private partnership data in particular. Is there a theory of change? If public-private partnership data is strong, there may be a chance to do a payroll tax like Vermont. Does that come up at all in your work, this kind of policy initiative, and that you can speak on in terms of Jason's question?
Not exactly, but I can also get that information because we work, especially in this field, as a collaborative. So wherever there are gaps or blind spots, we often support each other in creating that, or creating a statement of theory of change to kind of come and put us together as a workforce and advocacy organizations to push for change. So I can also, if I can get that question, I can also bring that back to my team.
Okay. And here's the last one I'll ask that I think we have time for. What is the best way to address the fundamental problem that the field cannot rely on parent fees to cover the full cost of care? The cost has to be shared among the general public and supported by public dollars across the board, as it is a public good. Any thoughts you have on that issue of the real dilemma between the true cost and what we're so far have been unable to do about addressing that?
In our advocacy efforts and work, what's been successful is when we have educators meet their delegates in district and their state legislator with talking points and speak to that. And if there's a parent, so I always say, and this is something that we're working with now as we're putting together a documentary, have a parent with you, because it already, depending on the state that you're in, because we know that the states vary on the spectrum of friendly towards childcare versus not, it automatically eliminates that divide of there's not enough to invest in childcare because we're investing in families. So it's a real time where it's like you have both people supportive of what is to sustain the field and demand for adequate cost of living, as well as having families come from an angle as I made the intentional choice of placing my child in this person's care, because, and then they bring their stories. That's been extremely valuable and hard to kind of like tune off or kind of ignore. So if whenever possible, there's a critical mass of stories that you can share with both, again, your state delegates while they're in your district. And it's often more successful, I find, going to them when they're here versus DC, and your state legislator, and having the talking points and having multiple people speak to that. I find that to be the most successful route so far.
Excellent. Thank you very much for your presentation and for your willingness to answer these questions. I don't see additional specific questions on this list. So I am going to ask Daisy just to advance the slides to discuss what we're going to do in the 6th webinar. The 6th webinar, as Sandra said earlier in this webinar, is the last webinar in this series. And in that webinar, which will be on April 22nd, we're going to focus on financial support policies that are really also at this institutional and structural level, such as tax incentives, lotteries, and other efforts such as those to help the early childhood workforce. We're going to talk more about sustainability, implementation, and working across sectors to try to build more of a cohesive set of partners who are working together to achieve the ends that we seek. And we're going to have as our collaborating partners Start Early. So we encourage you to join us on the 22nd. Sandra will also mention the next consultation session that we will have, the next and last one for this series. So we encourage you also to come to that consultation session. I think they have been very productive and effective in terms of being able to talk in a much smaller group about the issues that you are confronting. So I want to thank our partners today for joining us and turn this over now to Sandra.
Thank you so much, Dr. Ray, and thank you, Dr. Sherry Killen-Stewart, and Yessie and Alicia for sharing all of that, your expertise and all of that great work that is happening on behalf of the ECE workforce, family childcare educators, and in Ohio. We look forward to seeing you, as has been mentioned, next month on April 22nd. And before you leave, we do ask that you take a few minutes to complete the post-webinar survey. Through this survey, we do gather information directly from you about where you are interested in going deeper. I know many of you posted questions in the Q&A today that I think could be really great topics to explore with each other during the consultative session. Those sessions are an opportunity to interact directly with the facilitators from today's session, as well as with each other, and learn about what each other is doing in their state, their community, their program. And I know that during our last session, those who joined expressed, how much it was a valuable experience to dialogue with each other on these topics. So encourage you to complete that survey and to plan to attend that next consultative session that is on May 21st. So we are ending a little bit early. You have plenty of time to take a few minutes to complete that survey before you get on to the next meeting I'm sure you have on your busy calendar. So thank you so much for joining us today. We look forward to seeing what you add to that survey. And as always, we are so grateful for the work that you do every day on behalf of the ECE workforce. And we thank you for joining us, and we'll see you next month.